Calcium is released into the sarcomere. It will bind to troponin. When it binds to troponin will change its shape. The changing shape causes actin to rotate, exposing the binding site. Myosin will hydrolyze the ATP to ADP and phosphate, exposing its binding site. Phosphate will be removed, which allows the myosin to bind to the actin. The ADP will also be removed, allowing the myosin heads to change shape and slide. When ATP is added back onto the myosin, this will break the bond between actin and myosin. In concentric muscle contractions, calcium is released into the sarcomere. Calcium binds with troponin. The binding of calcium and troponin allows for troponin to change its shape. The changing shape allows actin to rotate, exposing the actin binding site. ATP is hydrolyzed on the myosin head and left with ADP and phosphate. The hydrolyzation of ATP allows for the exposure of the myosin binding site. Phosphate is then released from the myosin head. This allows for the actin and myosin to bind. ADP is then released from the myosin head. The releasing of ADP will allow the actin and myosin to slide. In concentric, the actin slide towards each other. In concentric, ATP is then added back onto the myosin head to release the actin-myosin bond. In eccentric muscle contractions, the calcium is released into the sarcomere. Calcium will bind with troponin. When calcium binds with troponin, troponin will change its shape. After troponin's shape is changed, the actin will rotate, exposing the actin binding sites. ATP will be hydrolyzed to ADP and phosphate, and the ATP will be removed from the myosin. Phosphate will then be removed from the myosin, and the removal of phosphate will allow for the actin and myosin to bind. After the actin and myosin bind, ADP will be removed. In eccentric muscle contraction, the actin will move away from the myosin. In eccentric, there is no ATP being added on, so the actin is being removed without the use of ATP. In eccentric muscle contractions, the actin-myosin bond is removed without ATP. It is theorized that titin will help guide the removal of the actin-myosin bond.